Top tips for toilet training. Hello, we are the Child Development Team and are part of the Children's Public Health Team, which incorporates health visiting and school nursing. My name is Anne-Marie Todhunter, nursery nurse within the Child Development Team. Firstly, consider the following. Most children can control their bowels before their bladder. By the age of 1, most babies have stopped doing poos at night. By the age of 2, some children will be dry during the day, but this is still quite early. By the age of 3, 9 out of 10 children are dry most days. Even then, all children have the odd accident, especially when they are excited, upset, or absorbed in something else. By the age of 4, most children are reliably dry during the day. It usually takes a little longer for children to learn to stay dry throughout the night. Things you can do to help before starting toilet training. You may want to introduce sitting on the potty as part of your child's normal day when they're around 18 months to 2 years. Some people choose to start earlier. Completing all nappy changes in the bathroom and promoting the potty when changing the nappy. Placing poo from the nappy into the toilet and your child flushing this away and then washing hands. This helps your child begin to understand where poo belongs. Potty training is a good time to start talking about the importance of hand washing. Hand washing. To stay healthy and clean, it is important for children to wash their hands after using the toilet, before eating, after coughing or sneezing, after playing with pets, after getting dirty. You don't need to wash your hands for long, around 20 seconds. It is about the length of time it would take to sing happy birthday 2 times. How to teach your child to wash their hands. Explain to your child that washing hands can help to keep them and others healthy. Even though they cannot see germs, they may still be there. A quick rinse of the hands isn't enough to keep them clean. Show your child the correct guide to washing their hands. Wet your hands fully. Add soap to your wet hands. If your child has sensitivities, they may prefer using an unscented soap. Rub hands together, palm to palm. Use one hand to rub the back of the other hand and then swap over. Clean in between your fingers. Rub your fingers into your soapy palms to clean the nails and tips of the fingers. Clean your thumbs. Rinse well with warm water. Dry thoroughly on a clean towel, paper or dryer. Knowing when my child is ready. They know when they've got a wet or dirty nappy. They get to know when they're peeing and may tell you when they're doing it. They show they need to pee by fidgeting or going somewhere quiet or hidden. They know when they need to pee and may say so in advance. They show an interest in the potty or toilet and are keen to sit on. Your child can sit down on the potty or toilet and get back up again. Using a potty is a new skill for your child to learn. It is best to take it slowly and go at your child's pace. Being patient with them will help them get it right, even if you sometimes feel frustrated. Try potty training when there are no great disruptions or changes to your child or your family's routine. It is important to stay consistent so you do not confuse your child. Check that any other people who look after your child can help with potty training in the same way as you. Speak with your child's nursery childcare provider and let them know that you are hoping to start. Getting ready for potty training. Using a potty will be new to your child, so get them used to the idea gradually. Talk about your child's nappy changes as you do them, so they understand wee and poo and what a wet nappy means. If you always change their nappy in the bathroom when you're at home, they will learn that's a place where to go to the loo. Helping you flush the toilet and wash their hands is a good idea. Leave a potty where your child can see it with open access to a bathroom and explain what it is for. Children learn by watching and copying. If you've got an older child, your younger child may see them using it, which will be a great help. It helps to let your child see you using the toilet and explain what you're doing. Using your child's toys to show what the potty is for can also help along with storybooks on potty training. You could see if your child is happy to sit on the potty for a moment, just to get used to it when you're changing their nappy, especially when you're getting them dressed for the day or ready for bed at night. How to start potty training. Having nappy off time and wearing pants. Keeping the potty in the bathroom. If that's upstairs, keep another potty downstairs so your child can reach the potty easily wherever they are. The idea is to make sitting on the potty part of everyday life for your child. Encourage your child to sit on the potty after meals. Having a book to look at or toys to play with can help your child sit on the potty. Avoid asking them to use the potty or toilet too much. Try and allow them to think for themselves. Encourage them to use the potty to wee will help build their confidence for when they are ready to use it to poo. As soon as you see your child knows when they are going to pee, encourage them to use the potty. Do not make a fuss when they have had an accident, otherwise they will feel anxious and are more likely to be unsuccessful the next time. Put them in clothes that are easy to change and avoid tights and clothes with zips or lots of buttons. Your child will be delighted when they succeed. A little praise from you will help a lot. It can be quite tricky to get the balance right between giving praise and making a big deal out of it. Do not give sweets as a reward, but you could try using a sticker chart. If you go out, take the potty with you so your child understands that you'd like them to wee or poo in the potty every time they need to go. If your child is not ready to stop wearing nappies and it is hard for them to know when they've done a wee, you can place a piece of folded kitchen paper or a flannel inside their nappy. It will stay wet and should help your child to learn that weeing makes you feel wet. Useful approaches at any age. Remain relaxed, avoid projecting your frustration and anxiety onto the child. Blowing bubbles while sitting on a toilet helps the child to relax their muscles, and this can help with mild constipation or anxiety. Have the toilet or the potty ready, available and comfortable, and make the toilet child friendly. Toilet seat, step, maybe a book to look at. Keep them in pants, knickers and not pull-ups. Use pull-ups over pants as a last resort when out. Modelling. Let them see you using the toilet. Keep children fully clothed for toileting. Do not strip them below the waist. Pulling down pants is a skill they need to learn. Everyone is different. Normal bowel movement frequency is as little as 3 times a week, as frequent as 3 times a day after every meal. A healthy poo that contains the right amount of water is type 4 on the poo checker. See the Bristol Poo chart. Normal bowel movements. How often is normal for a child? 3 times a week minimum, 3 times a day maximum. Food travels from the stomach through the small intestines and it becomes very liquid, like a poo soup. It enters the large intestine, bowel as liquid. As it travels round towards the anus, water from the poo is reabsorbed. The soup starts to become more like a porridge and eventually it becomes sausage-like. When the poo sausage reaches the anus, the pressure on the sphincter informs us we need to have a poo. Why is good drinking so important? Keeps us hydrated. Supplies our digestive system the right amount of liquid to digest our food and make type 4 poo. Reduces constipation risk. Dilute urine reduces risk of urinary tract infection. Helps develop bladder strength. Bladder health. If children are drinking the correct amount, their urine should be pale in colour. They should be passing urine 4 to 7 times per day, and the bladder should be empty when they have finished. About 2 hourly is the correct interval for most. Going to the toilet for a wee after a drink is a good idea. No child should ever have to hold a full bladder of wee. When you need to go, you need to go. Weeing too frequently does not allow the bladder muscles to strengthen. Encourage routine to establish these patterns. Using the toilet instead of the potty. Some children start using the toilet instead of the potty earlier than others. A child's trainer seat that clips onto the toilet can help your child feel safer and more confident on the toilet. A step for your child to rest their feet on gets your child in a good position for doing a poo. If you have a boy, encourage them to sit down to pee. If they also need a poo, sitting down will encourage them to go. Only pooing in a nappy. It is normal for children to prefer pooing in their nappy rather than in the potty or toilet. Do not get angry with your child if they poo in their nappy, as this may frighten them and lead to constipation. First, make sure they are not constipated. If it is painful for them to pass poo, they may try withholding from pooing. Make sure they are familiar with the potty or the toilet. Some children may fear the toilet and they will need to overcome this fear first. Allow your child to wear their nappy but loosen the sides. After each successful step, loosen the nappy further until it falls off, so the poo drops into the toilet. If sitting on the potty, try laying the nappy open inside of the potty. Children with additional needs. For many children with additional needs or long-term illness, the process of toilet training is the same. This may mean the timings is later, so this guidance on here should be tried first. This can be challenging for them and for you, but it is important not to avoid potty training for too long. If this is not successful, then specialist services and advice may be required. Toilet and potty refusal. Encourage sitting on the toilet even when wearing the nappy. Cut a hole in the nappy after time so the child still feels the comfort of the nappy, but the poo goes into the toilet. Gradually reduce the size of the nappy, explaining they are big boy or girl and the nappies are getting too small for them. All of this may take time. Do not rush it, and a child may find their own way at some point with no further intervention. Some children and adults will not poo away from home, even if this means waiting all day. Use books, bubbles, wall charts as appropriate, with lots of comfort and reassurance. Nighttime potty training. Focus on getting your child potty trained during the day before you start leaving their nappy off at night. If your child's nappy is dry or only slightly damp, when your child wakes for a few mornings in a row, they may be ready for nighttime potty training. Ask your child to use the potty last thing before they go to bed and make sure it's close by so they can use it if they need to wee in the night. There are bound to be a few accidents, so a waterproof sheet to protect your child's mattress is a good idea. Just like daytime potty training, it is important to praise your child for success. If these things are not going well, stick with nappies at night for a while longer and try again in a few weeks' time. Bedwetting help and strategies. Encourage regular daytime fluids. Stop drinks 1 hour before bed. Remove pull-ups to increase sensation. Protect mattress. Try not to lift child when asleep for toilet. This disturbs the sleep cycles and encourages wetting during sleep. Involve your child. Make it fun. Stay positive. Routine. Double voiding. Offer in the toilet and then repeat just before getting into bed. Bathroom accessible. Seek help if constipation is suspected. Remember, be positive, be realistic, use the strategies, use the resources. Next steps. Speak to your health visiting team if your child is about to start preschool and is not yet toilet trained. Still having toileting accidents, this will likely be upsetting for them, so it is a good idea to seek advice. If no improvement has been made with toilet training after 3 months, please consider to get in touch. 0300 123 3444. For more information and support, you can contact Eric, the Children's Bowel and Bladder Charity, for information on potty training. You can call the Eric helpline on 0808 801 0343, Monday to Thursday, 10 a.m. to 2 p.m. Or you can email the Eric helpline via a web form. For more information and support, you can contact Eric, the Children's Bowel and Bladder Charity, for information on potty training.